I kept just having breakdown after breakdown. I had a lot of suicidal ideation.
Young people in crisis.
I didn't like to talk about how I felt or my feelings that I had. I would just push them away because I felt like it wasn't important.
Kids suffering in silence.
By a show of hands, how many of you sitting here feel like you faced a mental health crisis or challenge? Everybody.
Children waiting in emergency rooms, unable to access the care they need.
Whether it's a physical or mental illness, it's still an illness.
Some kids are being left behind, for sure.
The work to turn this around.
Anyone can be that person to start those conversations.
Boston 25 gets real about kids and mental health. I'm Kerry Kavanaugh. 3 years after the start of the pandemic, our kids are still suffering, and it's still a struggle for many to find the help they need. For the next 30 minutes, we're examining what's going on. A recent CDC report was devastating. It revealed more than 1 in 4 girls reported they seriously considered attempting suicide. For LGBTQ+ students, nearly 1 in 4 attempted suicide. Tonight, we begin with a local teen story. They're bravely opening up about their darkest moments and what it was like to be in crisis in an emergency room, waiting for help.
I cried a lot. I spent like 4 or 5 hours just sitting in a chair, staring at a blank wall.
That's how Alex Bullis describes their stays in the ER after they turned to the hospital in mental health crisis. Alex, who's non-binary, says their first trip to the ER in 2020 lasted 6 days, as there were no available resources. It's a process called boarding.
What do you want people to know about what that feels like?
It's like a little prison cell. There was like no time other than that I felt even worse.
The Douglas teen says they struggle with abuse suffered as a child, which started to manifest in self-harm.
Like I had a lot of suicidal ideation, and that's when I started like experimenting with self-harm. And one day we got into a fight and I showed her my self-harm scars out of anger.
Every time we felt like things were okay, then the providers and the insurance would say, "You're all set, you don't need us anymore."
Mom Beth Bergstrom says Alex was in a painful cycle in and out of the ER several times.
You had a psychiatrist and you had these providers, but you weren't allowed to access them while you were in boarding.
What kind of trauma can a child face if they do turn to an emergency room and they are then just stuck there?
They may end up doing worse, becoming more self-injurious, exhibiting more harmful behaviors.
Dr. Patricia Ibeziaco is with the Department of Psychiatry and Behavioral Sciences at Boston Children's. She says by definition, boarding means a child isn't in the right setting for what they need, and that can exacerbate trauma and stress for an entire family.
We're not able to give them a sense of how long they'll be waiting for a bed, where they're going to get hospitalized, how long they're going to spend in the hospital when they do get the bed.
When your kid is sick, your kid is sick. Whether it's a physical or mental illness, it's still an illness.
And this mom says she wants other families to know they're not alone. And so does Alex.
It's so hard to talk about this. Why did you want to speak out?
If no one else is going to do it, might as well be me.
She was very brave. Take this, the week of March 20th, there were 131 children boarding in hospitals waiting for the services they need. That's according to the Mass Health and Hospital Association. From Beacon Hill to school districts, there's renewed focus on kids' mental health. I assembled a panel of local high schoolers and asked them if that focus is paying off, the help they're getting, and what more they need. Tell me true or false. Right now, there is a crisis when it comes to youth mental health.
True.
For those of you comfortable answering this, if you could, by a show of hands, how many of you sitting here feel like you faced a mental health crisis or challenge? Everybody. It's been a tough couple of years. I brought together 9 different teenagers from 3 different school districts, Chelsea, Gloucester, and Wakefield, all navigating life after a global pandemic.
We were in middle school when the pandemic started.
School will be off for a week, 2 weeks max.
Right.
And then it turned into 3 years. People were losing their jobs. People were getting COVID. It was a struggle. We truly didn't know what to do.
Kids were not spared the stress we all felt when COVID-19 hit.
Because when you change your whole learning way to like learning over a screen, it's very difficult to grasp that information.
So I think like our social connections were really just like, they were lost in that time period. So now we don't really know how to interact with each other anymore. Coming back and just kind of like a sudden
just jump back into reality is really hard.
We've shown you the numbers before. More than 1 in 3 high school students experienced poor mental health during the pandemic. Nearly half of students felt persistently sad or hopeless. 2/3 said they had difficulty with schoolwork.
I know what remote learning looked like, but what did it feel like?
I didn't like to talk about how I felt or my feelings that I had. I would just push them away because I felt like it wasn't important. I just kept everything to myself.
It was just a very hard situation, having the pressure on themselves to like manage schooling, and probably they're taking care of their siblings.
It's been going on even before the pandemic, but the pandemic, it just made it be seen since it all happened all at once.
Seeing a crisis that comes with stigma.
I'm Hispanic, so there's a stereotype that if you're depressed, you're just being lazy.
Because it is an invisible illness, people don't, sometimes they don't believe in it.
So what have the grown-ups in the room been doing to help you guys that's working?
I feel like they're opening more doors, contacting more like college programs, other things like that, and I really find that helpful, and I want more of that.
Over the past few years, we get more adjustment counselors, and there's more organizations that come to the school that you can talk to.
I think it's very important that the social workers and members of the school have realized that every student is struggling in their own way.
I feel like this is a good way to speak out.
And find the courage to be vulnerable, opening up and sharing.
For right now, it might be hard, but it will get easier. It has not gotten easier for me. Like, I know at some point I will wake up and I will not want to just sit there and cry.
For me, yeah, I kind of get scared whenever I'm talking about mental health, because it's kind of, when you talk about mental health, it makes you more, it's hard to say, vulnerable.
Yeah.
I don't like that feeling, even though it's good to get everything out.
If you don't ask for help for any of the people that you need, that supports you and those stuff, it could bring to a consequence that it will affect and damage your health.
Where do you get the courage to talk about mental health and not fear the stigma?
I think being part of the NAN project as well as Youth Action Team has really helped me realize the signs of mental health and when someone needs help or when I need to get myself some help. And it's just made me more confident to be vulnerable and talk about my feelings with other people.
And these young people tell me they're stepping up and learning about mental health to advocate for themselves and their friends.
Spread information and show support.
No matter how hard the wind blows, you gotta keep going.
It's okay to ask for help.
Everybody deserves to live their best life, so really if you need help, reach out.
To parents, I'd say give your kid a chance and don't push them too hard.
I just want to say that you matter, and even if you feel somebody is going through worse than you, it's still important to take care of yourself.
So you have someone to have a supportive arm with you who will help you throughout your life.
You're not alone.
You're not alone.
A big thank you to our students from Chelsea, Gloucester, and Wakefield for their courage and candor. The American Academy of Pediatrics has a website, healthychildren.org. It shares ways for parents to spot mental health warning signs in their teens. Find that and other resources right now on our website, boston25news.com. Still to come, 25 Investigates found certain kids who turn to emergency rooms in crisis are getting stuck in hospitals even if they're ready to be discharged. Most of them are in the care of DCF.
Some kids are being left behind, for sure.
Why these children end up with no home to return to, and the legislative push to change that. Then,
so when we come in and we kind of look like them and we act like them, they're like, oh, I know I can talk to that person.
A local nonprofit giving high school students the tools to have tough conversations about mental health. The 3 things anyone can do right now to connect with a loved one in need. But next,
you need to check on yourself, check on your emotions.
Celtic star Jaylen Brown shares his advice, why he says it's so important to check in on yourself.
Hi, I'm Jaylen Brown from the Boston Celtics, and I would like to talk about the importance of mental health. I lost one of my best friends when I was 21 or 22. To suicide, and mental health is something that I think everybody should check and monitor daily. I look at it as we're like a car. You need to make sure you check your tires, check your brakes, check your oil, and things like that. And that's just basically an analogy to say that, you know, you need to check on yourself, check on your emotions, your mental state of mind, everything in order, because if you don't check those things, the car will kind of break down. So I like to encourage everyone to kind of do those daily checkups, like, you know, maybe ask somebody how's their tires, you know, or something like that, you know. But mental health is extremely important, and I hope you guys, you know, are thinking about that on a daily basis.
Thank you to Jalen Brown for contributing to our special Boston 25 Gets Real about kids and mental health. Now to a story focused on some of the most vulnerable kids in the state. 25 Investigates found certain kids who turn to the ER in need are getting stuck in hospitals even if they're ready to be discharged. A new report revealed kids involved with state agencies like the Department of Children and Families are often the ones left with no place to go.
They're having to apply for resources that aren't easily accessible. They're having to wait, are very limited. Some kids are being left behind, for sure.
Amara Anosike is the Director of Behavioral Health Policy and Advocacy at Boston Children's Hospital. Boston Children's, like many hospitals, is on the front lines of the youth mental health crisis, as kids can end up waiting days or weeks in the hospital for the care they need somewhere else. But for children with acute mental health needs who are also involved with state agencies like DCF, Anosike says some are not getting enough support and advocacy.
You oftentimes get stuck in a system, and all these state agencies are fighting over who's supposed to pay for it.
It could be DCF, another state agency, a school district, or all of the above. 25 Investigates obtained a new report that reveals dozens of state agency-involved children are getting stuck in hospitals with no place to go. The Massachusetts Health and Hospital Association and the Massachusetts Association for Behavioral Health Systems surveyed 29 hospitals and 5 freestanding psychiatric facilities. In December 2022, they found 69 such stuck patients. 57 were involved with DCF. That's 83%.
Let's not think about what agency provides what. Let's just look at this child and see, what does this child need and how do we make it happen?
State Representative Marjorie Decker says that's the crux of her new legislation that's trying to ensure kids involved with state agencies have access to the care they need and a place to go and get it.
Too often children and adolescents lose their place in a group home.
Decker says in some cases the state is closing out their placements, a group home or foster home, once they leave them seeking that medical care. Decker, a Cambridge Democrat, chairs the state's Joint Committee of Public Health. She says her legislation would require DCF to maintain the child's original placement while their medical needs are determined. And she says it would also eliminate some red tape about how agencies should respond.
If you don't name who's responsible, then everyone's responsible or no one's responsible. Without DCF, being there to pull together the agencies and advocate, it doesn't get done.
That hospital survey said more than half of the pediatric stuck patients waited more than 10 days. The longest wait times were between 61 and 100 days. I asked DCF about the children in their care waiting in hospitals or other facilities with no place to go. The agency says their placements are reviewed on a case-by-case basis. A spokesperson adding, for those children who require a higher level of mental or behavioral health treatment than DCF foster care can provide, DCF works with multiple state agencies to find appropriate placements.
Are you concerned that right now the agencies that touch these children's lives are sort of turning their backs on them once they land in these crisis situations?
Yeah, I don't think anyone who works at these agencies is turning their backs on any child. I think that systemically, the bureaucracy actually creates these silos.
And Decker says her bill also requires that data be collected on how many kids are boarding, for how long, and what agencies are involved, and whether that child was denied the opportunity to return to their original placement. For help finding local mental health resources for your family, reach out to the National Alliance on Mental Illness at namimass.org/kids. You can find that on our website as well. Your local station continues our look at the youth mental health crisis. We're taking you inside a local high school where kids are learning how to talk about it.
Someone who's going through the depths of depression feels like they have no one to talk to.
3 simple but powerful steps you can take to keep someone from suffering in silence. But next, rethinking the college experience after a series of devastating losses. The major investment on one local campus to make student wellness a priority.
These are compression
Welcome back to our in-depth special on kids and mental health. Recently, the pain of this issue manifested on the campus of Worcester Polytechnic Institute. 7 students died suddenly. Many of them took their own lives. Now campus officials are responding with a $10 million wellness program.
I've been here for 30 years. Last year was the year that stands out as the most difficult for this campus, just in terms of the challenges with so many student deaths, and many of them due to suicide.
Sending wave after wave of pain across the WPI campus. Sarah Silvestri is a sophomore.
Personally, I lost my uncle for the same reason, so I had a hard time on campus when everyone was talking about it last year. So the fact that they're actually taking steps is definitely needed, and I'm glad it's finally happening.
What's happening is addressing the mental health of students both inside and outside the classroom. It's a multi-million-dollar program. The centerpiece is the new Center for Well-Being.
Close the door, sit in this comfortable seat. These are compression boots that they put on their legs.
Charlie Morris is the Dean of Student Wellness. He says it was important to locate the center in a highly visible area.
It needs to be in a high traffic area. So of course we're right here on the quad, adjacent to the main dining service, a stone's throw from the fitness center.
And to make the space tranquil.
It's a refuge. You hear the water wall in the background. It's designed to be calming, just a place to disconnect.
And if this doesn't look like a traditional engineering class, well, that's because it isn't.
It's a meditation seminar where we learn about the theory and practice of meditation. We learn a lot about Buddhism and pragmatic spiritualism.
Andrew Strauss now meditates on his own and thinks this approach could help some students.
I have lots of friends that definitely struggle mentally. I think it's a net positive for sure.
It's part of a big cultural shift taking place on the Worcester campus, but changing attitudes can take time.
So I don't think it's about decreasing the rigor of the environment. I do think it's about increasing all the resources within the environment to be more supportive, more compassionate.
The new programs at WPI are also available to faculty and staff. Still to come, what if you're worried that you or someone you care about needs help?
I think it can be difficult if someone tells you they're in emotional pain, that they've maybe been thinking about suicide, not to have a reaction, but that is so important.
We're going inside a local high school as students learn the tools and language they need to talk about mental health. And we'll share simple steps that you can take to help someone in need. It's a conversation anyone can have, but not everyone knows how to do it. A local nonprofit is helping high school students learn the tools and language they need to talk to a friend or a grown-up if they're concerned about their own or someone else's mental health. I went up to Gloucester to see this group in action.
Today we're going to be talking about mental health.
Creating a space to talk.
We can go over a couple of those warning signs.
On this day, it was inside a classroom at Gloucester High School.
We are going to be talking about mental health. We're going to be touching on the topic of suicide. We know this stuff affects everybody in different ways.
This conversation is the root of the NAN Project, a nonprofit that supports and advocates for suicide prevention and mental health education for Massachusetts students.
Are you guys familiar with OCD?
Leading the discussion is Kerry Kavanaugh, the NAN Project's executive director and co-founder.
I started it with my mother because in 2012, I lost my little sister Nan to suicide.
Jake says his sister struggled with her mental health for years, but fought to spare others her pain. Jake says he too struggled, not knowing how to help her.
I'm not a therapist. I don't have the tools to talk to someone about depression. I don't know what it's like to struggle with depression. But I think I've come to realize that anyone can be that person to start those conversations.
So the NAN Project works to empower students with the language they need if they believe they know someone in need.
Tell me more.
I saw firsthand how these conversations start in local high school health classes and how key
I felt like the pressure of everything was too much.
the personal experiences of peer mentors and coordinators are to them.
And so I can really speak to what it's like to be a student and what it's like to live with depression.
Peer coordinator Sarojini Shutt says it's important students see and hear someone who looks like them.
You never know what the kids are going through. You don't know what they're bringing in. We always say, like, kids have more than just books in their backpacks.
So it's important to be able to recognize the warning signs and then know what to say.
One thing we would encourage is, just checking in on them, asking them how they're doing. Sounds so simple.
The NAN Project says that check-in is a simple but powerful first step. Next, listen, but don't react, don't judge, and then help them find a trusted adult to talk to. Don't try to solve anything on your own.
It's just having a little bit of knowledge and a little bit of confidence to say, hey, I'm here.
It's about empowerment. Someone who's going through the depths of depression feels like they have no one to talk to. And unless you take that first step, oftentimes they'll struggle in silence.
Just reaching out may help someone realize they're not alone. A simple but so very important conversation. The NAN Project has presented to more than 30,000 Massachusetts students over the last 6 years. Thank you for joining us for this in-depth special on kids and mental health. If your family's in need of help, you can find expert resources right now on our website. Just click that Gets Real tab. We'll connect you to the sites and organizations we shared in this special and more. I'm Kerry Kavanaugh. Again, thank you for being here. Your local station will continue this very important conversation.